Uh, I wanted to ask both of you what you think about the idea that external support sometimes feels safer than internal resources. How do you feel about that?
I heard it. I heard a lot of it during COVID. I don't want to be on the elevator with my therapist from EAP. I don't want this. I still have clients even now that come to me that don't want to go through insurance because they don't have evidence of going through. I think there is a stigma, and the more we can talk about it and normalize it, it may make for more opportunities for people to heal. But for me, yeah, I still hear about it. I don't want to have therapy where I work. I want it to be external. I want a place that I can say anything I want to say, that I can complain all I want to complain and not be worried it gets bad.
Yeah, I mean, we see it all the time, and I understand. Like, I've even had nurses say, "I don't even want it to go through my insurance." Like it just really that deep of a stigma, and I think that was perpetuated a little bit by our licensure, right? Because if you went to therapy for substance use, and it got reported for your license, like there was just a lot there for you to unpack. So I think it's definitely it's improving, but I do think people prefer an external resource just from that stigma alone. I always recommend both. I tell people, both options, EAP and Marvin, for us at Novant, and let them. I say try both because they're both couple of sessions that are free, so try it and see which one you like. But it seems that people still have that stigma and really want to go external to the point of even paying out of pocket to not use their insurance. So
it's frequent. It's one of the emotional PPE project. Our board president did research looking at how the licensure applications looked and where the checkbox was compared to have you had mental health treatment? And on some it went mental health treatment, convicted of a crime. I mean, there's been this perpetuating stigma about mental health across the board for a lot of the licensing paperwork too. So you start really at the beginning of your career with this messaging. And so it's how do we break the stigma, right? How do we change the culture?
Absolutely.
How do we shift?
Yes, and that has been very well needed. So I want to make sure that we leave time for questions, but one of the themes I feel like I've heard today is that support really isn't defined by whether resources exist. It's defined by whether or not people can get access to the right support at the moment that they need it. And that recovery really from these events isn't just a single conversation. It's not a debrief. It's not even a wellness initiative. It's a process. The organizations that do well with this aren't waiting for people to ask for help, but they've built systems. They've built systems that know how to respond and when help is needed the most. Does that seem like a fair statement?
Absolutely.
Yeah, I completely agree. I can't tell you the number of times that I've put resources in front of someone and they didn't hear a word of it until the next day, and they call and say, I know you gave me something. I know you talked to me about something, but can you go over it again? So that's why a lot of times I'll be like, can I put it in your phone now? That way you'll have it, or I'll email it. And it really takes that follow up, because I feel like in the moment, it's just so much information overload, information processing, still processing the event. And so it really does take that continual follow-up reminder of what's available, how to get to it. It has to be easy. If it's 15 clicks, you lost them at 2. And so, it has to be QR code or something extremely easy to get people enrolled, user-friendly. Marvin has where you can kind of help dictate who you want to meet with, and people love that. So you have to meet people where they are. And after these critical event moments, handing them a page of resources, isn't it?
I so appreciate that you said that. That is the one moment that's the worst time to hand people most information, right? Because you're already overloaded. Your brain's not processing anything. A lot of people are numb, slightly dissociated. They're just surviving. And so if you're like, okay, now do all this, they're like, I'm sorry, what? So I love the follow-up. I love the idea of access and consistency of outreach. So yeah, appreciate it.